Very good, Mayor. You are on the air and you are live.
All right, thank you very much. Welcome, everyone. I'm Mayor Linda Gorton, and today is our final session of our Mayor's Virtual Neighborhood Summit Series. Although we held two prior in-person summits last year, COVID-19 has prevented those in-person events this year. But we didn't want to stop the success of the events, so we've gone virtual. I have always stressed how important neighborhoods are in Lexington. That's where I first learned so much about our own community. Neighborhood associations and groups can really make quality of life better. And if you don't live in an area with a neighborhood association, you can still work together with your neighbors to beautify, to advocate, and you can form a neighborhood association. Right now, in the middle of a global pandemic, our neighbors are more important than ever. Now's the perfect time to give a neighbor a call, knock on the door and leave a special treat, or just simply say hello, wearing your mask, of course. We are all facing isolation as we battle COVID-19, and our neighborhoods can be the sense of community that we need. The neighborhood summits are focused on sharing information and ideas. Even though we can't do it in person this year over coffee and donuts, we can still listen and learn. Before we move on to today's discussion, I want to recognize our council members. If you watched our sessions on Tuesday and Wednesday, you heard me state their names and recognize them, but it's so important to thank them. They serve our city well, and they work with our neighborhoods every single day. Thank you to our council members for stepping up to the plate and representing community voices. In case you don't know who your council member is, let me just quickly go through them. Vice Mayor Steve Kay, council members at large Richard Maloney and Chuck Ellinger, 1st District James Brown, 2nd District Josh McKern, 3rd District Mark Swanson, 4th District Susan Lamb, 5th District Bill Farmer, 6th District Lisa Higgins Horde, 7th District Preston Worley, 8th District Fred Brown, 9th District Jennifer Massotti, 10th District Amanda Mays Bledsoe, 11th District Jennifer Reynolds, and 12th District Councilmember Kathy Ploman. On Tuesday, we had a virtual panel discussion on Lexington's public works and infrastructure. And yesterday, we had a discussion on the work of the Mayor's Commission on Racial Justice and Equality. We appreciate our panelists who participated. Those sessions will be available online to watch as you can. Now, for today's virtual discussion, we want to talk about the issue that has really transformed everyone's life this year, COVID-19. The first confirmed case of the virus in Kentucky occurred on March 6th. In the 37 weeks since then, Kentucky has had 144,753 reported cases and 1,712 deaths. Here in Lexington, we've had 14,551 cases and, unfortunately, 106 deaths. To say this has been shocking would be an understatement. I don't think any of us expected a pandemic or that it would have such a long impact on our everyday lives. In Lexington, we had already started preparing for COVID-19 in February. My panelists will remember that we called together our stakeholders in person to talk about what they were planning. We knew this was going to come to our community and we needed to prepare. Our first community stakeholder meeting took place March 3rd, where we brought together healthcare, education, business, and government leaders to talk about how each one was preparing and to share information. From there, our community acted quickly when the first case was reported. And I'm so proud of our community and how we've dealt with COVID-19. I think many of us have taken this very seriously, and we've been flexible in the ever-changing environment in which we're living. So let's get to today's panel discussion. Today, I'm joined by three panelists um, who have been working. Actually, I think there are only two, basically nonstop during the past 8 months. COVID-19 has taken over their lives. I think that's safe to say. And I would like each of them to introduce themselves and tell us a little bit of an overview on how COVID-19 has affected you and what you've been doing in your position to prepare and respond to the virus. Now, first, I'm very pleased to welcome Lexington-Fayette County Health Commissioner Dr. Craig Humbaugh, who I believe has worked nearly every single day on this. Craig, welcome.
Thank you, Mayor. It's a pleasure to be here with you and to be asked to participate in part of this conversation at the Virtual Neighborhood Summit. So a little background on me. I'm a pediatrician. I'm, as you said, the Commissioner of Health here at the Lexington-Fayette County Health Department. Our mission is helping Lexington be well. So that's one of our jobs, is to help try to stem the tide of epidemic, and in this case, a pandemic. And we'll be talking more about exactly what that means. But I am really blessed to have a wonderful team here at the health department that has been working, as you said, really night and day for the last 8.5 months to help us slow the spread of the pandemic in Lexington. And we're doing everything from traditional epidemiology and utilizing those tools like case investigations and contact tracing, to enforcement of guidance, public health guidance and regulations around the community as well, to education for the public, and to preparing data so that the public can see what's happening in terms of the pandemic, and that policymakers can make the best decisions possible based on the most current data.
Well, you and your team have been awesome.
Thank you.
And when you and I stood up for that first press conference, I think it was on the Friday evening of March 6th. When
That always happens on a Friday evening.
Of course it does. And, I was so optimistic. This will be past us by July, right? No. So thank you very much for that, Craig. And I appreciate your being here. And speaking of the team, you mentioned how important your team is. My team is also very important inside government. And so I want to welcome my Chief of Staff, Tyler Scott, who's here with us today. So I'll let him introduce himself.
Sure. Thank you, Mayor. Good morning. Thank you, Dr. Humbaugh. Good to see you. I think it might have been 2 days now since we've last talked, which is a bit of a stretch from when this all started back on March 6th. I think our worlds intersected much more closely and frequently than I would have anticipated in this job coming in 2 years ago almost. I think if you dial it all back, I think we had this initial conversation in late February about what this strange new virus was that was sweeping across Asia and starting to pop up in the Western United States, and what our preparations should start to look like if and when it comes here to Lexington. And it wasn't maybe a week and a half later. That conversation paid off, but we've done nothing but talk about it ever since. And I think inside government, in our role, we spent a lot of time talking to the Dr. Humbaughs of the world, the Dr. Stacks, the medical experts, the public health experts, who provide the best advice and up-to-date expertise on what this virus does and doesn't do, to really keep us informed, to make the best recommendations I possibly can to the mayor and to council and others on how to respond appropriately. And it's it's a constant game of absorb new information, react to new crises, and then immediately turn around and think about what 2 steps ahead looks like. And that's a really complicated game in a world where we have a virus that hasn't really taken shape in the broader population like this in over a century. And it quickly compounded into a significant economic recession, significant unemployment, a little bit of federal relief early on, and then a pretty significant stalling of any further efforts to help stem that continued breaking of the dam that we see. So my days have typically been spent touching between the governor's office and understanding what his new guidance will be and how that'll impact us, and what's hurting the most in Lexington. Where are our first responders right now? Do we have an outbreak in a fire station? Do we need to reallocate funds for overtime? Do we need to do something different at our corrections center? We have a federal inmate facility here that had an outbreak early on, which was a significant hurdle, but we were able to work with our federal partners at the congressional and Senate level to help get in there and ease the crisis there. It's constantly in contact with our healthcare providers, understanding their urgencies and their needs. Early on, PPE was the most critical issue. I think we saw a massive rush to stockpile as much as everyone possibly could. We tried to play as integral of a role as we possibly could to make sure all of our first responders and all of our hospitals and everyone who was really on the front lines of this had every bit of resourcing they possibly needed. And then, Mayor, I don't know if you want me to shift in anything else right now, but we really stepped in early into addressing the testing side of addressing this.
We'll talk about that in a minute.
Okay.
But that's a great, Tyler has really kind of captured what exactly has been going on here in government and how we've been kind of turning on a dime to do something new and different. I have on at least one occasion said to him, remind me what we were doing last year. Because for many people, last year is somewhat of a blur because we've been so intense in this COVID-19 work. So
I think we were lining up breakfast options for folks at the senior center for the neighborhood summit at about this time.
Oh, I think you're right. That's right. Well, let's get to some questions. We actually have had some citizens email in questions. And Dr. Humbaugh, I'd like to start with you for a couple of questions. And these are just right up your alley, kind of getting back to basics. So if you can explain exactly what is this coronavirus and why is it so dangerous for some people and not for others?
Yeah, that's a great question. So kind of going back to, as you said originally, the basics of this is a virus that we didn't know as a world a year ago. And as such, it has the potential to affect everyone. In other words, everyone is non-immune or susceptible unless they've had the virus recently, then we're all susceptible. And that's kind of the definition of a pandemic, which is a worldwide epidemic where everybody can get a particular virus. And this particular virus is a respiratory virus primarily. It spreads much like the flu. There are small droplets that come out of people's mouths that are infected, and you can't see those droplets, but when you sing or sneeze or cough or even forcefully talk, those droplets are being expelled from your mouth and nose, and then you can potentially infect others because the droplets carry the viruses in them. That's the primary mode of the spread of the virus. The secondary or less important method of spread is when the virus gets on a surface, for instance, it lands on a surface, and then we don't wash our hands, we touch the surface, and then we touch our mouth, our nose, our eyes, and we infect ourselves in that way. So that's why, and we're going to come back to this, I'm sure, throughout this hour. Hand washing is so important. Mask wearing is so important because that creates a barrier for those droplets. Okay. And that's also why staying at least 6 feet distant from someone is so important, because these droplets only travel so far. We can't really see them, but they're not traveling across the room. They're traveling within a fairly short distance of where we are if we're infectious. So I think your question gets to the heart of the matter about some of our biggest challenges with this virus, besides the fact that we're all non-immune. And that is that we've had one of the main challenges is that there's a wide spectrum of illness associated with this virus. So some people are actually they never develop symptoms at all, and they're infected. Okay, and they can spread the disease. Okay, so they're called what we call asymptomatic or non-symptomatic carriers. And almost all of us, if we get the disease, are carrying or able to spread the virus for the 2 days before we develop symptoms, because that's when our body's manufacturing more virus and ramping it up and able to spread it. And then we have the other end of the spectrum, which is what you really talked about, Mayor Gordon, the sad piece, which is we have people who are dying from the virus and its complications. And as you said, we've had 106, tragically had 106 deaths here in Lexington. About 1% of all the recorded cases in Lexington have ended in death. And then we have people who are somewhere in between. And those who are more likely to have severe illness or to have complications are folks who are older. So 80% of those who have died, over 80%, have been people 65 years of age and older. We also know that people with chronic illnesses, and that's unfortunately a lot of us in Kentucky, we're not the healthiest state in the union. And when we're overweight or we have other chronic illnesses like heart disease or lung disease, then we can be more susceptible to have severe illness and be hospitalized and suffer those acute consequences of COVID-19. So I think that's why we need to sit up and pay attention, because we've got a small but significant number of people who have really severe illness. The other thing that we need to be aware of, because we're new to this virus, it's becoming clearer every day that there are people even with moderate or mild disease who later are developing negative health consequences that are ongoing for many, many months, as an after effect, so to speak, of having had infection with the virus that causes COVID-19. And the jury's still out on that. We don't know, because we've only been dealing with this for thank goodness, less than a year now, right? So that's where we are on that. The other thing I would say is the challenge that we've had is, and again, I talked about this a little bit, is that we have so many people who are not necessarily symptomatic, and they're spreading the virus and they don't know who they are. So they may be inadvertently doing it. And that's how clever this virus is. I mean, because to be blunt, if everyone had severe consequences, then it couldn't continue to propagate person to person. So this is how it cleverly operates. And that's why it's been such a challenge for all of us to deal with.
Those are great points. You reminded me when you talked about the spread and coughing and talking loudly. And most of us, a few months ago, have seen the videos of the scientists who had the Petri dishes and had people cough into them with masks and without masks. And then some of them used lights to show the kind of particles traveling, and it was pretty graphic. And then to see what grew in the medium when you were coughing without a mask, it was very surprising and shocking. I think a lot of people saw that. What's your opinion, Dr. Humbaugh, about why right now we are having such a huge surge? And if I understand, it's worldwide. I know it's all over the country. Are people tired of masking, or what do you think's going on? Has the virus changed?
Yeah. It's a great question. And first of all, you're right, Mayor. Unfortunately, we're seeing the highest levels of community transmission that we have ever seen since the pandemic began here in Lexington. And if you're looking at the governor's chart that shows, the different colors in green, yellow, orange, and red, we're well above the threshold for the red zone, unfortunately, in terms of numbers of cases that are being reported daily. And it is a good question. I think part of it is fatigue on the part of folks. We've been doing a great job for 8 months. We need to remember why we're practicing public health recommendations, who we're doing it for our loved ones. Maybe we're not at high risk, but others, friends, neighbors, family members are at high risk. It's winter, it's colder. During that season, unfortunately, we come indoors, and because of that, we're closer necessarily to others, even in our own household. So we need to remember that that's a risk factor, right? And so that's probably contributing to the rise in the spread of disease as well. And that's why we're so concerned in the public health world about the upcoming holidays, when traditionally we physically get together to celebrate the holidays with family and friends. And we as a society need to think about how we're going to be doing that in a different way and still celebrate the core of and the spirit of the holidays.
Mm-hmm. Good point. Thank you. Now, Tyler, Gail Reese has asked a question, and this question is actually a great question, but I never thought this type of question would be asked, but it makes sense. So here goes. Has the COVID quarantine expanded the creativity of thought for housing regulations in Fayette County to include 2 full kitchens in a single structure or 2 structures in an R1 zoned residential area to accommodate caregiving and isolation when needed? Pretty good question, huh?
It is a very good question. I think that's something that wouldn't be as front and center previous to compared to anything else as it would be in a world where we're talking about the need for quarantines, the risk of exposure to folks in congregate living facilities where a lot of our elderly citizens are housed, and the risk exposure we've seen there, and the desire for a lot of families to want to bring them home and accommodate their living situation within their own property. So I did have to reach out to our director of planning, Jim Duncan, to assist with some of the facts on this matter. So just for a little background on this, the ADU zoning ordinance text amendment was prepared by our staff and received community input for over a 2-year period. Was presented to the Planning Commission, had a public hearing in September 2019. In 2019, the Planning Commission recommended approval. It was approved by council, and so essentially the city can't have any ADUs until the council amends the zoning ordinance as it exists today. It was developed and, like I said, approved long before COVID in a pre-COVID world, and any additional conversations of real meaning and depth, I think, have been significantly sidelined based on the constraints put on public input due to COVID. I think there certainly is interest on our planning staff side to further consider what the ADU scenario might look like, especially now that I won't say it's a failure of imagination here. It's just an eye-opening to new realities we may exist in the near future and further down the road. So I think there's with all that in context, I think there certainly is a willingness and an appetite to have that conversation amongst planning and the community as well.
One of our citizens, Susan Bachner, had a comment about it, about looking at the ADUs through a COVID-19 lens, which of course a year ago we never would have thought about. But one of her comments was that ADUs, accessory dwelling units, could potentially allow repurposing of space in a home's lower level for new living space and enable a loved one who needed to be near family but couldn't really live with family to happen. I mean, it's an interesting concept that way. So I appreciate those thoughts from planning and from you. Dr. Humbaugh, I know you've had a kind of a change in contact tracing. And can you give us a quick update on contact tracing? And then I'd like you to speak a little bit about how COVID-19 is affecting different areas of our community and different demographics,
Okay.
ethnicities, age, gender, et cetera.
Right. So I think the first question is around case investigation and contact tracing. And a lot of times people use the broad term contact tracing to mean everything that we're doing here. Our focus has always been from the beginning to try to identify people who test positive for COVID-19 early, get them interviewed, find out where they may have been while they were infectious during their infectious period, and then get them isolated. So that means get them away from other people as much as possible that may be in back in their household until they have recovered or been released from isolation according to CDC guidance. So until the point that they're really not infectious anymore. So that's one of the tools that we have in our toolbox. There are several tools that we have to try to slow the spread. And our goal from the beginning has been to slow the spread enough that our healthcare system can accommodate or take care of our sickest patients. We know this is a pandemic. We don't have illusions to think that we can stop it, but we this spread, okay, if that makes sense. And this is one of the ways that we can do that, and that's our continued goal. However, when we get so many cases per day, around 200 per day now, just in Lexington alone, in Lexington residents, there's less return on our investment to try to sort out individually from a health department standpoint and contact each one of the people who's had very close contact with a person who's tested positive. We have changed our procedure to rely more on the person who's tested positive to notify their close contacts, especially their household contacts, but others that they have that are socially contacts to them or people who are in their work, and let them know that they should quarantine. Who do we consider to be a close contact? Well, that's anybody who spent 6 feet or more with the person who tested positive for 15 minutes or more. I'm sorry, with anybody who's been for 15 minutes or more within 6 feet or less, okay? So that's our definition, and as we move forward, we'll still be concentrating on getting cases, people who tested positive, isolated, and we'll be putting more of the onus on people who test positive to help us with notifying their contacts and telling them what to do in terms of quarantine. We have developed handouts or flyers. They're on our website. We're sending those to our cases. and they can send those to their contacts as well. So I think, that will help us do that. There will be specific situations where we'll be helping. There are higher risk situations where we'll be helping businesses or daycares or schools or others determine who those close contacts are. Maybe a nursing home situation. We may not necessarily be sending them quarantine orders or telling them. That may be the business, that may be the nursing home, it may be the child care. So, but we will be helping them determine who those close contacts are. So this is just for us to streamline the process, use our resources most effectively, where we can do the best good when we have so many cases in the community.
Well, it makes total sense. I mean, we've gotten to a point where there's so many cases that it's really, you'd have to have a huge army of people to do all the traditional contact tracing. Tyler, this next question was for both of you, but I'm going to start with you. So now that we know COVID-19 spreading so rapidly through the community in many different ways, not only what can we do to be safe, and I think we've talked some about that already, but what can we do to make sure that businesses are not so stressed that they have to close permanently and put people out of work? I mean, this is today's question, right?
Right. Obviously, it's very relevant with the new mandates that came down from the governor's office yesterday. Nobody likes to see this environment that we're in, but unfortunately, I think there's just we've pushed ourselves into a scenario where I think we were going to get here either way. And I say that, and I mean that I think even if there were no mandates whatsoever, there would still be such a high risk of so many businesses on the verge of going under, because the threat and the fear of the virus is so prevalent now. The desire to want to go into a restaurant and sit down and eat. For me, example, I would not take my family out there right now. You see the spread of cases in Lexington is so prevalent now that I don't think, I think many are weighing that risk factor and saying it's not like it was earlier when we were seeing a few dozen cases a day. Now you're looking at a much different contact ratio, I'll call it, of the number of people you might pass in a street or in a setting that is exponentially climbed, that increases your risk factor. So I say it to say I don't know that I think these restrictions are the primary driver of a lot of the risk of closures and the threats to business. I think it comes down to the virus itself. The virus is the risk and the cause of the harm to our economy and to businesses and the ability to function normally. I think continuing to do what we've been doing and follow and support the public health guidance that's out there, that is the best available to date, that masks do work. They protect you, they protect me. They aren't the end all be all, but they are impactful in a lot of ways. Social distancing absolutely has an impact. I know from your office, Mayor, and we'll continue to do so, we will continue to support our local businesses, promote buying local, especially get your takeout now, support these businesses, these restaurants that have to go without providing indoor dining accommodations for the next few weeks. We've got to do everything we can. If you want me to, I can talk about some of the things we've already done to try to.
I was just getting ready to go there because we have helped business owners.
Yes.
And so I wanted to ask you to tell folks what we have done so far.
Yeah. So some of the things we did through the mayor's office and a lot of work with council as well. Early on, we suspended some ordinances that allowed our restaurants, bars, and also some of our retail that had the ability to do it to accommodate further space, whether it be on sidewalks, some public parking situations, also their own private parking, to spread their footprint, I guess, as you will, beyond what they normally would be allowed to do to accommodate the 50% or 33% capacity restrictions that were on there. We worked to connect some of our restaurants with concrete companies, for example, who had some of those barriers that were necessary to protect outdoor seating from passing traffic. We extended that suspension of the ordinance in the next year. I think it's been highly successful. I think it's actually added a unique set of vibrancy that you see in a lot of countries and a lot of cities in Europe and other larger cities where you see a more thriving outdoor entertaining and dining venue. I think it's been a nice addition to the city, and I think there's a lot to build on moving forward. We also passed the Small Business Assistance Program. It was $2.5 million out of the city's budget to go to small businesses. There was a max of $25,000 per entity to use for to accommodate the restrictions or any other impacts to a business's budget to try to help them survive. A lot of them use them on things like outdoor heaters, outdoor seating, umbrellas, barriers, and PPE and things like that to accommodate safe dining and just an overall safe interaction in restaurants in general and other retail settings as well. And that helps. Just as important as doing that is the perception that people feel safe going out into these areas. And I think you see that a lot. People are really picking and choosing the grocery stores they see that are taking this seriously and they feel comfortable and safe in, compared to those who are more lax in their implementation of mask mandates and overall capacity restrictions and things like that. Anything else, Mary, you'd like me to hit on?
Well, no, I think that gives people a really good idea of some of the things we've been doing. We have been trying to help our businesses because we know they're struggling.
Mhm.
I want to turn to a different aspect of COVID, Dr. Humball. You know, there's been a lot of public discussion about the increase in depression and mental illness and people being locked down and then opened up partially. And one of the things that a lot of people are experiencing is the depression that comes from not being able to be with family and friends. And of course, that applies to Thanksgiving coming up, which is the traditional American holiday celebrated by nearly everyone. And so, do you have any thoughts about this? What people can do this is an impossible question. When will we all be able to get together again? I think the answer to that's when we're vaccinated, right? But it is a growing issue in our community.
Certainly, Mayor, it's something we're concerned about too. First of all, I want to say there is help for folks who are feeling lonely, who are feeling depressed, and I would urge people to seek the mental health resources that are out there in our community. There are good resources in our community for that. But I think the bigger question is about, when will we be able to, how could we safely celebrate Thanksgiving, the winter holidays? And I would say, I don't like the terms social distancing. I like physical distancing, because I would remind people that we can still be socially connected in 2020. And when I think about it, if this pandemic had happened 20 years ago, I don't think we would have had the technology to be able to do what we've been able to do the last 8.5 months. Because when we think about how we use the internet and how we use the technology very effectively to connect with others, and I would urge people to use the things that are at their fingertips to continue to connect with people, even though it may not be physically. And that's one of the things that you can do for the holidays. So reach out, prepare a Zoom meeting, a GoToMeeting, whatever platform you use with family and friends. Other possibilities are for you to share your dinner or share gifts with others, but not necessarily share that physical space with them. Drop it on the doorstep. I think you talked about that a little earlier, being a way for, shopping can still continue, but online or ordering out, as Tyler said, in the case of restaurants. We do that a lot on the weekends here at the health department. You all may too, to support our local restaurants. So I think we can still maintain some of the holiday traditions, but we're recreating them in a way for this particular year until we can get together again to be less at risk to ourselves and less at risk to spreading the virus to those who are more likely to have complications of COVID-19.
Well, and speaking of all of this now, one of the things that's been in the news this week that's very timely is the announcements by Pfizer and Moderna with the great looking success they've had with their vaccines. So, Dr. Humboldt, talk to us just very briefly about how the vaccines will be distributed, anything that you want to share about the process of knowing who will be first, who will be next. There is a kind of a pecking order.
Sure. So you're right. I mean, there are a couple of vaccine candidates that look very, very promising, and that many of us have been reading about in the news from a couple of different manufacturers, and they could be available to select, as you said, targeted populations that are first on the list as early as late next month or early January. So we'll see, how that's going. But there are still a lot we don't know. And I guess I want to emphasize that for the general public, I think it's unlikely that we'll have widespread vaccine availability until the spring. So while that's unfortunate, I think it's very hopeful that some of the folks who are most likely to be in contact with those who are cases can potentially get the vaccine sooner than that. And those in those highest, the highest categories, what we're calling the government's calling phase 1A, will be mainly healthcare workers and those who are first responders. And that makes sense to us because they're taking care of the sickest patients and they're protecting us. They're keeping our infrastructure of society going if they're first responders. And we need those people healthy at work, doing their jobs to protect the rest of us, right? And so those folks have been targeted to receive vaccine when it becomes available. It's likely to be available as an emergency use authorization through the FDA at first. It'll be available in very small quantities and through the federal government and state government. So basically the federal government buys up all of the vaccine from the manufacturers, and then it gets distributed out to state health departments, and from there to local health departments, to providers who have signed up to give the vaccine. So that's how we think it's going to work right now. There will probably be many changes between now and when the vaccine's available. We are very much working with partners in the community, with you all, with emergency management, with our hospitals, with our providers, to try to think about what are our plans going to be. And we also have to do this in a way that keeps the folks who are giving the vaccine and the folks who are getting the vaccine as safe as possible. So we have to reduce the risks of doing that, which means no crowded areas. So that's a challenge in itself, because those of you who are around 11 years ago when this happened with H1N1 vaccine know that we could have just lined up people and vaccinated them, but now it has to be spread out, and we have to be wearing PPE, and so there's a lot more to it than in the past.
Mhm. But we're getting closer
Yes, we are.
to the vaccine, and that's the exciting part. If people can just hang in there a little longer with the masks and the distancing and all of that, we are getting there, which is an amazing scientific feat for our scientific community that they could get there so fast.
It normally takes 5 to 10 years to develop a new vaccine. So yeah, this is lightning speed.
Yes.
We can do an effective vaccine within a year or so.
And it needed to be, Tyler, I want to switch to testing. You mentioned it earlier. You have really, Lexington's had a robust testing program, several different ones, and you really, I would say, we're in the middle of all of those. So give us kind of a brief rundown of how our testing's gone, what we have going on, and that sort of thing.
Okay, absolutely. And I think the exciting thing to say up front, I think, is I was unaware of it. Dr. Humboldt, you might have known it, but the governor shared it with us yesterday that
Yes.
the model we've developed here in Lexington, as well as the partnership with the state and what Louisville's done as well, is being used as the national model across the entire United States for how to conduct citywide and statewide testing. So there's a lot of good work that's it's nice to get those kind of pats on the back every once in a while, but I think it's due to a lot of people putting a lot of one quickly and early understanding the importance of getting this up and running, and making sure the coordination of this was not every silo was broken down immediately as we started to build it up. And I think if I had to sum up why ours has been successful, I'd say it's because we wanted to make sure it was easily accessible. And by that, I mean, there were not long wait lines. There were multiple testing sites throughout the city and options available to the public. We made sure that there were walk-up scenarios, so barriers to transportation were not a problem. We made sure we were constantly looking for opportunities to put the mayor's neighborhood testing program into a lot of our most vulnerable neighborhoods to make sure that walk-up could be a viable option for a lot of folks. To all the way to what the health department did with their innovative model of even going straight to the home to deliver test kits to those who couldn't even leave the house on their own. And I think that's going above and beyond what many other entities were even considering for a long time. We made sure we established strong lab contracts early on, more than just one lab, to make sure that backlog was brought down. And I think just as important as anything is how transparent and highly promoted the health department got behind it. We got behind it almost daily. Our emergency management team were promoting it. We saw a lot of buy-in from across the community to continue to promote the idea that it's safe. It's important to do. It is not. It does not have the stigma attached to it that we worried it might have early on. That if you went and got tested, it was because you'd been doing something wrong, and there might be something detrimental attached to you moving forward. It was more important to know whether you had it than to not. So I think it really caught on. I think we've seen a lot of benefit of using the mayor's neighborhood testing program to really, like I said, target those areas of where we saw early on minorities who were highly disproportionately affected by this virus. And that's not unique just to this virus, of course. This is unique to many morbidities across the board, but identifying that impact early on and making sure those testing sites were getting there into those communities, and we were breaking down language barriers and really getting buy-in from some of the local leadership to encourage people to come and get tested has proved to be very beneficial in stemming off the spread as much as it possibly can. That partnership we developed, like I said, with some of our private labs like Blue Water and UK and others to really come on board and exponentially grow their capacity to run these tests and get turnaround has been a big, I'd say it makes a big difference when you look here compared to other areas that are waiting weeks or more for a test to turn around. And it is nearly impossible to ask someone to sit there in quarantine in their home and not go to work for that long a period of time just to find out whether they're positive or negative. I think it's been great to keep that kind of momentum rolling. UK, of course, along with testing all their students, they've also opened up a number of their sites to the public, which was just continued to decrease the pressure valve on some of our public testing sites. All of our hospitals early on got into running mobile testing sites for their own employees, but they also looked to expand it to all their patients. And it all came together very well in a good coordinated fashion. We talk every single week with Dr. Humbaugh and all our healthcare providers. He's in constant contact, staying on top of all these things. We make sure all the test results, at least all the positives, are coming directly through the health department, and it's in real time. I think that's the most important thing was how much effort was put into this and identifying the potential for its impact early on. It's paid off for us now.
Mm-hmm. That's a great recap of all of that. And you mentioned one of the things that I think, there's if you look real hard, there are some silver linings to the pandemic. And I've thought that one of the ones that all of us on this panel realize is how well our healthcare community is now connected. I'm not sure it was in this same way before the pandemic, and I think that's a huge positive. Lots of sharing of information back and forth, lots of questioning back and forth of healthcare providers. And Dr. Humbaugh, you've been right in the middle of that, kind of the hub. And that is a beautiful silver lining for the future going forward. And through all these testing programs that Tyler's talked about and all of the initiatives just with our healthcare partners, that I think that will continue in some way or some form for the future. And that'll be a good thing for our community. Well, we're closing in on our time, but I have one last question, Dr. Humbaugh, that since Tyler talked about testing, and I wanted to ask about whether someone can accurately be tested for an antibody. So the antibodies form if you've had the virus, correct? And so your body has those antibodies. Can we test for those right now?
We can. Let's talk about the fact there are really two different types of tests. The test Tyler is mainly talking about is testing to see if you have disease now, if you're spreading the virus now, if you're infectious, okay? That's the kind of testing that's going on through drive-thrus and the mayor's neighborhood testing initiatives.
Mm-hmm.
But there is, and that is usually a test that requires a specimen either from the nose or from the mouth, like saliva, or you've got to get a nose sample. Okay.
Yeah.
And those of you who've had the test know
what
it's like, right? Okay.
We do.
So the antibody test is different. Okay. The antibody test, first of all, is not something we generally recommend. It should be done if the doctor recommends it. It can only tell us if we've been exposed in the past to COVID-19 at some time in the past, okay? It's because, like all viruses, COVID-19 viruses, no exception, we make antibodies to fight off the virus, right? And we can detect those antibodies. The problem with the current antibody tests that we have now is, yes, they will show us if we've developed antibodies to COVID-19, but we don't know what the cutoff or the threshold is to how many or how much of those antibodies we need to provide either short or long-term protection against the virus, okay? And it may be that some people have after they have a naturally occurring disease, they may have relatively short times of protection, okay? And some people may have longer, periods of protection. We haven't the science hasn't gotten there yet. And
Right.
so these tests can accurately do antibodies, but we don't know what that result means. Does that make sense?
Okay, that does make sense.
Yeah.
And a couple things I have thought about. Some people have said, well, I've had COVID and I'm over it, so now I'm immune. But that's not necessarily true based on what you just said. And then I know of some folks who believe that they had it before it was first identified here in Lexington. They were sick in February, and we do know there are some places before it was officially identified that they went back and someone did have it. I think, wasn't there someone in December of last year who in the United States now
I believe I
knows
did
they
see
had
that late December was
Mhm.
the earliest identified case out on the West Coast.
So I know some of those folks say, well, I wish I could have an antibody test because I haven't been sick since, but really it doesn't tell them anything that's useful, does it? From what you said, it doesn't tell them that they're
Not in
immune.
most circumstances. It could tell you,
Right.
have you had the disease? But the question that you really want to know is, am I immune currently to getting the
Yes.
disease again?
Can I
Right?
get it again?
Yeah, right.
Oh, well, unfortunately, we have been at this for an hour, and I want to thank both of you, Dr. Craig Humbaugh, Lexington Fayette County's Commissioner of Public Health, and my Chief of Staff, Tyler Scott. This has been really good discussion, and we've covered a lot today. And I know we could probably talk for another hour, but we don't have another hour. So I do want to go back to something I said in the very beginning, that Lexington has lost 106 of our citizens to this virus. And as we all know, these were mothers, fathers, sons, daughters, brothers, sisters. They were important people to family and friends. And as a city, I know we grieve for them. And for those who lost their loved ones, this was a really terrible time to lose a loved one to COVID because you couldn't be at their bedside. It was very sad. So I want to let everyone know that tomorrow, Friday the 20th, we are going to have a short service. We're calling it In Remembrance. It's going to be at 1:00 p.m. and it will be virtual. In the windows of the Pam Miller Downtown Arts Center, we will have the memorial, which will involve candles and recognition. And we want to do this for the families and friends of those we've lost. So again, I thank our panelists and appreciate all the great work each of you do for our community and for taking time to answer questions. And I want to thank the viewers who've tuned in. I've actually heard back from viewers who've been watching this week. And all of our sessions are recorded and they're available online. You can go to lexingtonky.gov and find them, and then we'll be sharing links to the recordings. So thank you so much to our panelists, to our citizens who've tuned in, and have a great day.
Thank you, Mayor. Thank you, Dr. Humboldt.
Thank you all.
Thank you.